What if your blood sugar is already running higher than it should be, but you have absolutely no idea? You wake up, go through your normal routine, eat breakfast, go to work, have lunch, and continue with your day. Maybe you feel a little tired. Maybe you're more thirsty than usual. Maybe you've been getting up at night to use the bathroom. Maybe you've noticed that your eyesight isn't quite as sharp as it used to be. And you may simply blame all of this on getting older, stress, poor sleep, or a busy lifestyle. But sometimes your body is giving you clues. High blood sugar doesn't always begin with a dramatic symptom. In fact, blood sugar can remain elevated for quite some time before a person realizes there may be a problem. And that's exactly why today's topic is so important. In this video, we're going to go through 7 possible warning signs that can occur when blood sugar is running too high. We'll also talk about insulin resistance, the foods and drinks that can cause large blood sugar spikes, why belly fat matters, why you may feel exhausted after eating, and what you can realistically do to improve your metabolic health. But there's one important thing to understand before we begin. Having one of these symptoms does not automatically mean you have diabetes or high blood sugar. Many of these symptoms can have other causes. The only way to know what's happening is through appropriate medical testing. So think of today's video as an awareness guide, not a diagnosis. Let's begin with the first warning sign. Warning sign number 1. You're constantly thirsty. Have you noticed that you're drinking much more water than you used to? Maybe you're carrying a water bottle everywhere. Maybe your mouth feels dry throughout the day. Or maybe you finish one glass of water and immediately want another. Occasional thirst is completely normal, but persistent excessive thirst can sometimes be associated with high blood glucose. Here's why. When blood glucose becomes too high, your kidneys may begin working harder to remove excess glucose from your bloodstream. That can increase urination. As you lose more fluid, your body can respond by making you feel increasingly thirsty. This can create a cycle. You drink more, you urinate more, you lose more fluid, and then you're thirsty again. But don't assume that being thirsty automatically means you have high blood sugar. Hot weather, exercise, salty foods, certain medications, dehydration, and many other conditions can increase thirst. The important thing is whether the change is persistent and unusual for you. If you've suddenly become extremely thirsty without an obvious explanation, especially if you're also urinating frequently, it's worth talking to a healthcare professional. Warning sign number 2. You're urinating more often. Here's another sign that can sometimes go together with excessive thirst. Frequent urination. You might notice that you're going to the bathroom much more often during the day, or you're suddenly waking up several times at night. Now, getting up once during the night can happen for many reasons. Drinking lots of fluids before bed can do it. Caffeine can do it. Certain medications can do it. And as people get older, nighttime urination can become more common for several reasons. But a noticeable increase in urination, especially when combined with increased thirst and fatigue, deserves attention. High blood glucose is one possible explanation. And if you've never had your blood sugar checked, this could be a good reason to schedule a routine medical evaluation. A simple blood test can provide much more useful information than trying to guess what's happening from symptoms alone. Warning sign number 3. You feel exhausted even after sleeping. Now let's talk about one of the most common complaints people have: fatigue. You sleep for 7 or 8 hours, you wake up, you have breakfast, and somehow, by the middle of the morning, you already feel drained. Then afternoon arrives. You feel like you need another coffee. Maybe you start depending on caffeine just to get through the day, and you might assume it's simply aging. But your energy levels are closely connected to how your body processes glucose. Glucose is one of the body's major sources of energy. Insulin helps move glucose from your bloodstream into cells where it can be used. But when someone develops insulin resistance, the body's cells don't respond to insulin as effectively. The pancreas may compensate by producing more insulin. For a while, the body can maintain blood glucose within a relatively normal range. But over time, the system can become increasingly strained. And that's one reason metabolic health matters long before someone develops obvious diabetes. However, fatigue is extremely nonspecific. Poor sleep, sleep apnea, anemia, thyroid problems, stress, depression, nutritional deficiencies, infections, medications, and many other conditions can cause fatigue. So don't use fatigue as proof that your blood sugar is high. Use persistent, unexplained fatigue as a reason to look at your overall health. Warning sign number 4, blurry or changing vision. Have you noticed that your vision occasionally becomes blurry? Maybe your glasses suddenly don't seem quite right. Maybe reading small text feels more difficult. Or perhaps your vision seems to change from one day to another. Blood sugar can affect the fluid balance in the lens of the eye, which can temporarily change vision when glucose levels change significantly. That doesn't mean every episode of blurry vision is caused by blood sugar, but persistent or sudden vision changes should never simply be ignored. There are many possible eye conditions that require evaluation. And if you're experiencing sudden vision loss, severe eye pain, flashes, a large increase in floaters, or other dramatic changes, seek urgent medical attention. Your eyesight is not something to experiment with. Warning sign number 5. Cuts and wounds seem to take longer to heal. Here's another clue people sometimes overlook. You get a small cut. Normally, you expect it to heal fairly quickly, but you notice that wounds seem to be taking longer than expected, or you're experiencing repeated infections. Persistently high blood glucose can affect several processes involved in immune function and wound healing. That's one reason people with poorly controlled diabetes can have more difficulty with certain infections and wounds. But again, slow healing has many possible explanations. Poor circulation, smoking, nutritional deficiencies, certain medications, infections, and other health conditions can contribute. So if you're repeatedly experiencing wounds that don't heal normally, don't simply cover them up and hope they disappear. Get them evaluated. Warning sign number 6. You're hungry again very soon after eating. Now here's a sign that many people experience without realizing how it connects to their eating pattern. You eat breakfast. An hour or two later, you're hungry again. You eat lunch. A couple of hours later, you're looking for something sweet. Then you eat dinner, and before bed, you want another snack. What is going on? Sometimes the problem isn't simply that you need more food. It can be the composition of the meal. A meal dominated by refined carbohydrates and added sugars can produce a relatively rapid rise in blood glucose. Your body responds with insulin. Then glucose levels fall. For some people, these fluctuations may be accompanied by hunger, cravings, or an energy crash. But hunger alone doesn't mean you have insulin resistance or diabetes. Your total calorie intake, protein intake, fiber intake, sleep, stress, physical activity, and eating habits all matter. One useful strategy is to build meals around protein, fiber-rich foods, vegetables, and minimally processed carbohydrates. For example, instead of eating a large bowl of sugary cereal alone, you could choose eggs with vegetables and a piece of whole fruit. Instead of eating cookies as a snack, you might choose plain yogurt with berries and a small portion of nuts. The goal isn't to eliminate carbohydrates, it's to improve the overall quality of the meal. Warning sign number 7. Dark patches around your neck. Now let's discuss a visible sign that can sometimes be associated with insulin resistance. It's called acanthosis nigricans. It can appear as darker, thicker, velvety-looking skin, often around the neck, armpits, or other skin folds. It can occur for several reasons, but insulin resistance is one important association. If you've noticed this type of skin change, particularly if you're also dealing with weight gain around the abdomen, high triglycerides, or a family history of diabetes, it's worth discussing with your healthcare provider. But don't try to diagnose yourself from a photograph. Skin conditions can look very similar to one another. A medical professional can help determine what you're actually seeing. The big question: why does insulin resistance happen? Now let's talk about what's happening underneath all of this. Insulin is a hormone. One of its important jobs is helping glucose move from your bloodstream into your cells. Think of insulin as part of the system that helps your body manage incoming energy. After you eat, especially after eating carbohydrates, glucose becomes available in your bloodstream. Your pancreas releases insulin. Your cells respond. Glucose can then be used or stored. But with insulin resistance, the cells don't respond as effectively. The pancreas may compensate by producing more insulin. This can continue for years. And that's why someone can have insulin resistance for a long time before eventually developing type 2 diabetes. The process is often gradual. That's also why prevention and early detection matter. Belly fat is more important than you think. Let's talk about abdominal fat. Not all body fat behaves exactly the same way. Visceral fat is stored around internal organs and is strongly associated with metabolic problems. Higher amounts of visceral fat are linked with insulin resistance and increased risk of type 2 diabetes and cardiovascular disease. This is one reason waist circumference can be a useful health marker. But don't obsess over one measurement. Your overall health includes blood pressure, blood glucose, cholesterol, physical activity, sleep, diet, family history, and many other factors. And here's something encouraging. You don't have to become extremely thin to improve your metabolic health. Even modest improvements in weight, physical activity, diet quality, and fitness can make a meaningful difference. The biggest food problem may be liquid sugar. Let's talk about one of the easiest changes you can make: sugary drinks, soda, sweetened tea, energy drinks, large specialty coffees, fruit-flavored drinks loaded with added sugar. These beverages can deliver a lot of sugar without making you feel very full. You can drink a large amount of calories in just a few minutes. And because liquid calories can be easy to consume quickly, they can contribute to excess calorie intake. Try replacing one sugary drink each day with water, then replace another. You don't need to transform your diet overnight. Small changes can become habits. And if you enjoy juice, remember that whole fruit generally provides more fiber and tends to be more filling than fruit juice. Do you have to stop eating carbs? No. This is where online health advice becomes unnecessarily extreme. Carbohydrates are not automatically bad. Fruits contain carbohydrates, vegetables contain carbohydrates, beans contain carbohydrates, whole grains contain carbohydrates. The important question is the type, amount, and overall dietary pattern. A bowl of lentils is not nutritionally equivalent to a sugary dessert. A whole apple is not the same as a bottle of soda. A serving of oats is not the same as a highly processed pastry. Instead of asking, "Are carbohydrates bad?" ask, "What type of carbohydrate am I eating? How much am I eating? And what am I eating with it?" That's a much more useful question. Build your plate this way. Here's a simple approach. Start with protein: eggs, fish, chicken, lean meat, Greek yogurt, beans, tofu, whatever fits your dietary preferences. Then add vegetables: broccoli, spinach, peppers, cauliflower, green beans, tomatoes, salad greens. Then add an appropriate portion of a high-fiber carbohydrate if you want one: beans, lentils, oats, whole grains, potatoes, fruit. Finally, include a reasonable source of healthy fat: olive oil, nuts, seeds, avocado, fatty fish. This type of meal is much more likely to keep you satisfied than a meal based primarily on refined carbohydrates and added sugar. What about coffee? Here's some good news for coffee lovers. Coffee consumption has been associated with several favorable metabolic and liver outcomes in observational research. But coffee isn't medicine, and adding large amounts of sugar, syrups, whipped cream, and high-calorie flavorings can completely change the nutritional profile of the drink. If you enjoy coffee, unsweetened or lightly sweetened coffee can fit into a healthy lifestyle for many adults. But if caffeine causes insomnia, anxiety, palpitations, or other problems, you don't need to force yourself to drink it. What about cinnamon? You may have heard that cinnamon can dramatically lower blood sugar. Research has investigated cinnamon and glucose metabolism, but the results are mixed, and any effect is generally not strong enough to treat diabetes. So enjoy cinnamon if you like it. Put it on oatmeal, add it to plain yogurt, use it in cooking. But don't stop taking prescribed medication because someone told you cinnamon is a natural replacement. Food can support health. It doesn't automatically replace medical treatment. What about apple cider vinegar? Apple cider vinegar is another popular remedy. Some research suggests vinegar may modestly affect blood glucose responses around meals, but it isn't a cure for diabetes, and drinking concentrated vinegar can irritate your throat and stomach and damage tooth enamel. If you use it, dilute it appropriately and don't treat it like medicine. And if you have medical conditions or take medications, talk to your healthcare professional before using it regularly. Walking after meals. Here's one simple habit that can be surprisingly useful. Walking after meals. You don't need a treadmill. You don't need a gym membership. You don't need an expensive fitness tracker. A short walk after eating can help your muscles use glucose. If you're currently inactive, start small. Walk for 10 minutes, then build from there. Over time, aim for regular physical activity throughout the week, and don't underestimate strength training. Building and maintaining muscle can support glucose metabolism because muscle tissue is an important site for glucose disposal. You don't need to become a bodybuilder. Bodyweight exercises, resistance bands, weights, or supervised strength training can all be useful options. Sleep and blood sugar. Now let's talk about something that people often ignore: sleep. When you consistently sleep too little, your appetite, stress hormones, insulin sensitivity, and food choices can all be affected. You may notice stronger cravings for high-calorie foods. You may feel less motivated to exercise. You may rely more heavily on caffeine, and the cycle continues. Aim for a consistent sleep schedule and adequate sleep. For most adults, around 7 to 9 hours is a reasonable target. If you're sleeping enough but still feel exhausted, especially if you snore loudly or wake up gasping, talk to a healthcare professional. Sleep apnea is common and can have important metabolic consequences. How do you actually know if your blood sugar is high? Now here's the most important part of this entire video. Symptoms are not enough. Testing is what tells you what is actually happening. A healthcare professional may use tests such as fasting blood glucose or an A1C test. The A1C test provides an estimate of your average blood glucose over roughly the previous 2 to 3 months. Depending on your situation, your doctor may recommend additional testing. And don't wait until you feel terrible. Type 2 diabetes can develop gradually. Some people have few or no noticeable symptoms. That's why routine screening can be valuable, especially for people with risk factors. Your age, family history, weight, physical activity, blood pressure, cholesterol, and previous blood glucose results can all influence your risk. Your simple 7-day blood sugar reset. Now let's create a realistic 7-day starting plan. Day 1. Remove sugary beverages. Replace them with water, sparkling water, or unsweetened drinks. Day 2. Take a 10 to 30 minute walk after one meal. Day 3. Add protein and vegetables to your first meal. Day 4. Replace one highly processed snack with a whole food option. Try fruit with nuts, plain yogurt, or vegetables with a protein-rich dip. Day 5. Eat more fiber-rich foods. Add beans, lentils, vegetables, berries, oats, or whole grains according to your dietary preferences. Day 6. Focus on sleep. Choose a consistent bedtime and reduce unnecessary screen time before bed. Day 7. Review your week. Don't ask, "Did I completely fix my blood sugar?" Instead ask, "Did I make better choices than I did 7 days ago?" That's the mindset that creates sustainable change. 3 things to stop doing. First, stop drinking large amounts of added sugar every day. Second, stop assuming that every symptom is simply because you're getting older. Third, stop relying on internet miracle cures instead of getting appropriate testing. Your health deserves better than guesswork. 3 things to start doing. Start moving after meals. Start building meals around protein, vegetables, and fiber-rich foods. And start paying attention to your health numbers. Know your blood pressure. Know your cholesterol. Know your blood glucose or A1C when appropriate. Knowledge gives you options, and early action gives you more opportunities to improve your health. Final message. Your body often gives you clues: constant thirst, frequent urination, unexplained fatigue, changes in vision, slow healing wounds, persistent hunger, certain skin changes. None of these signs automatically means you have diabetes, but when several appear together, especially alongside risk factors such as abdominal weight gain, high blood pressure, high triglycerides, or a family history of diabetes, it's worth talking with your healthcare professional. And remember something very important. You don't have to wait for a diagnosis before taking better care of your metabolic health. You can start today. Drink more water, cut back on sugary drinks, walk after meals, eat more vegetables, choose minimally processed foods more often, get enough sleep, build muscle, and get your blood sugar checked when appropriate. You don't need a perfect diet. You need a sustainable one. You don't need to exercise for 2 hours every day. You need to move consistently. And you don't need a miracle supplement. You need habits that you can continue for months and years. Your blood sugar is only one part of your health, but it is an important one. So listen to your body, learn your numbers, and don't ignore persistent changes. Medical disclaimer. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent diabetes or any other medical condition. If you have symptoms of high blood sugar, risk factors for diabetes, abnormal test results, or take medication that affects blood glucose, speak with a qualified healthcare professional. Do not stop or change prescribed medication based on information from this video. If you found this video useful, make sure to like the video, subscribe to the channel, and turn on notifications for more health and wellness content. And let us know in the comments, which health topic should we cover next? Thanks for watching and take care of yourself.